You can send us a note to clickondetroit.com/kindness.
All right, let's head back to Bernie's place. He looks like he's back out of the batting cage now and talking, I guess, basketball instead of baseball off the start.
Well, yeah, because NBA Commissioner Adam Silver told the league owners last night that he will make a decision on the state of the current season in the next 2 to 4 weeks.
Picked off. Here's Bradley ahead of the field. Goes to James on the ball with the run first. Slam dunk.
You may see LeBron again this season. That's the same call last night, the one to the owners, where the owners afterwards felt positive the season would resume. Silver is studying all the factors that go into a decision like this. Health and safety, they are talking about being obviously the #1 priority. NHL Commissioner Gary Bettman says he's heard all the talk about the NHL season being canceled, but he says he's not interested. We've got highlights. And Bettman says in a group Zoom that he was talking to in San Jose that he confidently believes there will be a champion crowned this year. He says canceling the season is too easy a solution. He feels eventually there will be an opportunity to begin again. Baseball, the owners and the players did not meet today and did not schedule a meeting for today. But the owners made some noise. We'll tell you all about that coming up at 6 o'clock. Finally, when young kids are home during this pandemic, you got to keep them entertained. Check out this young boy who decided he wanted to make a pizza. We call this segment Imitation is the sincerest form of flattery. Everybody wants to make pizza. Love pizza.
You cannot start too early on learning to make pizza. That's fantastic.
Never.
Yeah.
Oh, absolutely.
Let's head to Ben's pizza place right now, Ben.
Yeah, fire something out on the grill tonight, guys, because that sunshine is bright out there, and this may be one of the nicer days that we've got until we get into the weekend. Temperatures right now close to 60, but here's the setup for tomorrow and what we're looking at and why Thursday is going to be kind of a write-off. We've got a warm front headed our way tomorrow, and the big question is how far north this front gets. Right now where you see that, that's pretty much at I-94. And so south of there, south zone, southern part of the metro and west zone, there's a chance that we could be seeing strong thunderstorms in the second half of tomorrow. Also note on there's heavy rain. That's going to be pretty much the morning round as in addition to those thunderstorms that we're expecting in the afternoon. So we've got really two threats that we're watching tomorrow, but the severe threat is going to be in the second half of the day and mainly south. You can see it here in the actual risk graphic, slight risk, which is category 2, a little bit lower marginal risk there north of 94. As you get into the north zone and west zone. So temperatures tonight are going to go down into the 40s for overnight lows. We will be seeing numbers going into the 70s by tomorrow afternoon, and that's where we will stay, with the exception of 80 degrees next Wednesday through the entire 7-day forecast. And notice that that average line is finally south of our temperatures. It's been a long time coming since we've seen that, guys.
All right, Ben. We have seen shortages of meat. Toilet paper, certainly. Clorox wipes. This one is a little different, though.
Why a farmer says there's a run on these adorable little chicks. Next.
The COVID-19 pandemic took many by surprise, and unfortunately, many were not financially prepared. Now we have expert advice for you tomorrow, starting at 6 a.m.
This Medical Minute is brought to you by Beaumont.
In these uncertain times, we are here for you. Beaumont is leading Michigan through the COVID-19 crisis, and we will help lead the way out. Our expert doctors and caregivers have created a secure environment so you can feel safe coming to us for care. If you have life-threatening symptoms, go to one of our emergency centers. If your surgery was postponed, call your doctor. They're ready to help. I can assure you, Beaumont is safe and ready to serve you.
$1 million and the title of Jeopardy, the greatest of all time, is on the line.
I got James on my back. I've got to go all in. 15,000.
Jeopardy, tonight at 7:30, only on Local 4.
Do I have coronavirus?
When will Michigan reopen?
When can I visit friends and family?
The answers will come with testing. Michigan now has expanded testing capacity, so people with symptoms and those without symptoms who work in public can now get tested. Contact a healthcare provider or use the test locator at michigan.gov/coronavirus-test.
Attention! If you attended the University of Michigan from 1967 to 2003 and suffered abuse by Robert E. Anderson, MD, the athletics director's team physician, please contact us today. We want to ensure that survivors are compensated and that the safety of students is the #1 priority for the university. Call us at 800-201-4810 or visit us online at uofmsexabuse.com.
Butter. Honey, look at this. 40,000 flavor combinations, and I've had almost every one. Asiago, butter, cheese, Cajun. The flavored crust combinations are endless. It's the greatest thing that ever happened.
Yeah, I'm gonna go.
To get more pizza? Yeah.
No, to call your mother. Wow.
Don't go. I need that equation.
Now get a meal deal to fit any budget at the home of flavored crust.
Hungry?
Howie!
Hey, Michigan. Filling out the census is quick and easy. Only 9 questions in 10 minutes. And no matter where you live, filling out your census helps fund things like roads, bridges, and highways. Aren't better roads worth 10 minutes of your time? So be sure to fill out the census this spring and count everyone in your home. When everyone counts, everyone wins. To learn more, please visit myvoicecounts.org. That's mivoicecounts.org.
Today's programming is brought to you in part by Tryon Solutions.
Construction crews back to work and doing some heavy lifting on I-75 this weekend. The freeway is going to be closed for the I-75 modernization project.
Both directions of I-75 are closing between 8 Mile and Square Lake Road starting Friday at 11 p.m. MDOT says workers are setting bridge beams and doing other road work. Woodward is your detour. I-75 opens back up Monday morning. It was an incredible view from the ground, but today we're getting to see what yesterday's Blue Angels flyover looked like from the air.
Take a look at this. The Navy posted this video showing the view from the cockpit. You see the Angels flying in formation. Their flight path took them from Ann Arbor to Detroit, then along Lake St. Clair. Blue Angels also flew over Chicago and Indianapolis, covering a lot of ground just yesterday. That's cool. Certain items have been in demand at the stores. You know that hand sanitizer, notoriously toilet paper, to name a few, but now there's a demand for chicks.
Yeah, farmers say there's such a demand for eggs that people are now buying chicks to raise for their eggs. Farmers also say raising chicks could be a way to stay busy as people are home more often. But a farmer does want to caution anyone who hears this and is interested that it takes a chick at least 6 months to start laying eggs. I don't think you're just going to get some chicks and they just...
Sounds like a great idea. Time, right? All right, Local 4 News at 6 is coming up next.
Coming up, how the state is responding after a mid-Michigan barber made news by reopening his shop in defiance to the governor's order.
Also, here's our Dr. Frank McGeorge. Doc?
Contact tracing is being called one of the keys to helping us return to a more normal life. I'm Dr. Frank McGeorge. Coming up, I'll show you exactly how it works and why your health is so critical.
An incredible team of nurses helping one of their own, a coworker, battle COVID-19.
I wanted it again to be focused on them because they were the reason that I'm a success story.
Tonight, that nurse shares her incredible story plus touching video of how the nurses saluted her.
With Michigan weather being so unpredictable, spend tax returns and profit-sharing checks where it matters most, your home. Call Ace & Sons today.
Don't go to the wrong place. Leave your insulation to Ace.
How's it going, hon?
Oh, it's going. I believe y'all. Everything gonna be all right.
I'm Mike Morse, and I believe in this town. If you've been injured, you call me.
855 Mike wins.
And let's go for the win.
Recent statistics show a large percentage of Michiganders can save over $1,000 a year by refinancing. Call 248-308-5000 or chat with us online at davidhallmortgage.com. Lower payments, better options, more personal attention.
Windows talk, now more than ever. They communicate our feelings. They deliver our love letters. They brighten our days. For 76 years, our Wallside family has proudly made and installed windows to improve your home and brighten your days. If you're ready to jumpstart your project, schedule a virtual appointment with a Wallside representative today. If not, we'll be here for you when you are.
Even in the face of the pandemic, DTE is here to serve. Our dedicated crews are working 24/7 to provide the reliable energy everyone in Michigan depends on. Especially now. We're tough. We'll power through. DTE.
Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 6 starts now.
A different type of detective. Contact tracers are about to become very important, but what exactly do they do? Sean.
A veteran nurse has to check into her own hospital. She has coronavirus, and her own team has to help her fight it.
I felt like I wanted to applaud them.
Tonight, that nurse shares her incredible story, plus video of how her own co-workers saluted her as she was finally able to go home.
Can't wait to bring you that one. But first, a look at where we stand with COVID-19 today.
The state is confirming 370 new cases, consistent with what we've been seeing. Sadly, there are 40 new deaths to report. 31,000 state employees will take a series of temporary layoffs through late July to help alleviate the expected budget shortfall due to the pandemic. The state could save up to $80 million through these furloughs.
Michigan Attorney General Dana Nessel putting out a warning ahead of the planned protest at the Capitol tomorrow. She says people breaking the law will be arrested. Governor Whitmer today said she hopes it doesn't come to that.
I think the Michigan State Police is monitoring all of the conversations around this event tomorrow. That they are prepared and are working with the Attorney General. I think we've seen some joint statements today, and I believe that if there is a reason to issue a ticket, that they're prepared to do that. I'm hopeful that they don't have reason to.
Well, meanwhile, the state has suspended the license of a barber who's defying Governor Whitmer's executive orders by opening his shop.
State's Licensing and Regulatory Department, LARA, announcing today it stripped Owasso barber Carl Mankey of his license. That move comes after a judge denied the state's request for a restraining order to close the shop. Mankey has received at least 2 tickets thus far for keeping his shop open. This would seem to be more expensive than those.
Yeah. Well, we've got a remarkable story for you tonight about a local nurse whose asthma made her uniquely vulnerable to COVID-19.
Now, she stayed home from her job at Mott's Children's Hospital, but still became infected and soon found herself in need of care. Now she and her colleagues at Michigan Health can celebrate her victory. But as Sean Lay reports, for a while, that outcome was uncertain.
This video clip I'm about to show you is absolutely so touching. A Michigan Health nurse being cheered on by her own co-workers because together they successfully battled COVID-19. An incredibly emotional moment for Michelle Davis and the team at the U of M Medical Center, cheering on Davis as she is finally released after a terrifying fight against COVID-19. Davis still touched by that moment.
How much they cared and how blessed I was that I was one of them that got to roll out of there.
It's unique because Davis is a co-worker, a veteran nurse at Mott Children's Pediatric Intensive Care Unit. And in the video, she too has the strength to applaud her healthcare heroes.
That's where my heart was. It really was at that point more about them than me, I think. as odd as that might seem.
April 11th, Davis's mom in hospice care passed away of non-COVID related issues, but she also couldn't breathe and went to the health system where she works, this time as a patient.
It was hard because I also felt like I was putting them at risk because somehow I got this. So there was actually a little bit of guilt there.
Davis says she was scared and spent days in the ICU.
And I think being in the ICU where you work, you know, there were people dying around me and I knew that. And I really have to give this shout out to the people that are on the front lines.
But Michelle Davis and her team at Michigan Health beat the virus, leading to this moment.
And so I felt like I wanted to applaud them as I was getting able to go home.
Michelle tells us this battle and lingering effects continues to take such a toll on her. She is urging everyone to take this virus and the precautions surrounding it extremely seriously. Sean Lay, Local 4.
All right, Sean. Coming under scrutiny today in Lansing, Michigan's emergency policy of housing positive COVID nursing home patients in nursing homes with COVID negative patients. State Senate committee had some tough questions today about that policy, which other states, like New York, have abandoned. We bring in Rod Maloney live tonight from Lansing with the updated information in his ongoing coverage of this issue. Rod?
Yeah, Devin, it's hours away from expiring, this executive order that the governor made about a month ago. In the meantime, we have confirmed that it's just under 700 deaths that the state has counted of people who have died in nursing homes, but they say those numbers are highly inaccurate. They're not sure if it undershoots by a lot or a little, but they say that they are not accurate numbers. In the meantime, there are many in the Senate right now who are wanting the governor to change this policy. The Department of Health and Human Services gave us more insight into the regional hub system. There are now 21 of them. States paying these homes $5,000 per COVID positive case they take. We also learned there are some nursing homes taking these patients that do not have the same strict separation policies the regional hubs are required to have. Only about half of the state's nursing homes have been inspected since the policy went into effect last month. HHS Director Robert Gordon told the committee,
"This is a world without perfect solutions. The solutions we've come up with, I think, aim to provide strong protections provide the care that COVID positive folks need and also strong protections for folks who are not COVID positive."
Gordon originally intended to use the TCF Center instead of these hubs, but then opted out. Detroit State Representative Leslie Love is stunned that didn't happen.
They said the population that would be most affected are our seniors. So to not outfit those facilities to handle the very population that they said would need it seems ridiculous to me.
State Senator Pete Lucido is furious.
I'm appalled of the fact that somebody wasn't at each of these facilities before any COVID patients entered these facilities to possibly infect others. How many were infected as a result of bringing a COVID patient to the most vulnerable people in the state?
Still lots of unanswered questions in all of this. In the meantime, the governor's office is telling me that they expect to do an extension of this order, but they haven't done it just yet. So we're waiting to find out if there are any changes or if it stays the same. Reporting live in Lansing, Rod Maloney, Local 4.
Okay, Rod. Contact tracing is being called one of the keys to helping us return to a more normal life. The state recently announced plans to hire up to 1,000 more contact tracers to work with local health departments. Our Dr. Frank McGeorge is here to explain exactly what they'll be doing and why this is so critical, Doc.
Yeah, Kim, contact tracing is something the public health departments routinely do for certain contagious illnesses like tuberculosis and measles. Well, now an army of contact tracers will be needed around the globe to track down cases of COVID-19 and stop them from spreading.
It's basically detective work.
Contact tracers are the boots on the ground, or in this case, on the phone, in the battle to control COVID-19.
Particularly in this pandemic context, as we're starting to reopen things, it allows us to prevent, hopefully, a resurgence of cases.
Josh Petrie teaches contact tracing at the University of Michigan School of Public Health. The goal is to break the chain of spread. When someone tests positive, they're assigned to a contact tracer.
And once we identify those new cases, it's really just contacting those cases, giving them information to isolate at home and how they can protect from spreading it to others, and then figuring out who they've already been in contact with.
That involves interviewing the person to determine everyone they've interacted with who could potentially be at risk.
The tracer then tracks the contacts down and asks them to quarantine for 14 days. It's labor intensive.
You need a lot of people to be calling, and the more cases that are out there that need to be investigated, the more work it is.
When a disease is widespread in the community, contact tracing isn't feasible. It also depends on testing.
You really need to be able to identify cases through testing. And if you don't have enough testing, you're going to miss cases, and then you're not going to be able to trace them.
Another limitation is trust. People who test positive need to be willing to share their contacts and other vital information.
The trust is really key, and we all play a part in that. The goal here will be, as we reopen and have relatively low numbers of cases eventually, you'll want to be able to track them and identify early when things are starting to pick up, and identify cases early so that you can keep them at home, so that really the stay-at-home restrictions are limited to people who are sick and potentially even contacts of people who are sick.
Yeah, and contact tracers also follow up frequently with their cases and their contacts to monitor their symptoms, provide information, and connect them with help or testing if needed.
Yeah. Oh, I know we've heard of other countries using phone apps that can alert you if you've come in contact with somebody who tests positive. Do you know if there are any plans to use something like that here?
Well, you know, Kim, it's a really interesting idea, but not yet is the answer. Obviously, there are a lot of privacy and trust issues with that technology. Now, Utah is experimenting with one app, but ultimately, we are going to be relying on an army of human contact tracers to get this job done.
Yeah,
back to you.
Okay, thanks, Doc.
Now, with more industries welcoming back workers in the coming weeks, employers have questions about how to make sure that their offices and workspaces are safe. Grant Herms talked to two Detroit app developers who think they have some answers. Grant?
As businesses push to reopen, redesigning the workplace will be essential. It's why developers at Detroit-based Andonix have created a new app to track workers now allowed back to work.
With Safely, you can use your phone to fill in any wellness forms. And
the app is called Safely. It's designed to streamline access points at businesses. Workers will still have to have their temperatures checked and fill out a specialized questionnaire, which once done can be scanned to let them into the building. From there, each user gets a color, allowing them to be in certain places of their workspace, and creates a heat map where employers can see who's too close, and health officials can monitor and adapt social distancing guidelines.
Detection really starts at the door, and so we have to enable a process that creates a real structure around how do you get into a company and into a building, and what becomes or has to become a safe space. And then ultimately, what happens once you cross that door?
So far in beta testing, the Safely app has found several hotspots at buildings and offices like bathrooms, break rooms, and entryways in small hallways. And all that data monitoring is raising questions about what's being watched, who's watching it, and where that data goes once it's been collected.
If you elect and opt in to share your location, it's not different than Waze or Google Maps, where you basically are anonymous to everyone. You see yourself in the map, and you see like traffic, like the heat map shows like traffic. So nobody knows who you are. Nobody knows where you are.
The app is already being used by major manufacturers like Fiat Chrysler, American Axle, and Master Electronics. And Andonix plans to break into industries like food processing and healthcare, where phones may not be allowed in workspaces through automated detection, hoping to have safety at work for everyone right at our fingertips. In Detroit, Grant Herms, Local 4.
Okay, thanks, Grant. Well, we're reaching for 60 degrees. Let's check in with Ben.
You know, Kim, we're going to be even warmer tomorrow. However, it comes with a threat of heavy rain and possibly severe storms. We'll look at the time.